what the source of the pain is. R is the region or radiation of the pain, so exactly where is the pain? Is it lower? Is it upper? Is it in the middle? Is it around the belly button as far as the abdomen? You know, and you can do this with any body system. Is it chest pain? Is it here? Is it substernal? Is it down here? Where is the pain? And the other thing is radiation. Does it move? Does it, you know, always stay right around your belly button, or when you twist, does it move to your back? Is it always down in the left lower quadrant, right lower quadrant, or does it move up? You know, does it start here and does it move up your sternum? Those sorts of things. T is the temporal or the time sort of nature of the pain. So when did it start? How long does it last? Does it come and does it go? Is it constant? Is it associated with any time of the day? Do you just have this pain in the morning? Do you just have this pain at night? Do you just have this pain, you know, in the middle of the day after you've eaten a heavy meal? And then finally, there are other factors. So we're thinking about nonverbal factors. We're thinking about whether or not our patient has this horrible grimace on their face, or whether or not they're completely calm. And there are also cultural factors, because some people interpret pain in different ways, but it's still good to look at that. Vocalizations, so are they groaning? Are they moaning? Those sorts of things. Younger patients, you might look at agitation, you might look at restlessness, because they might not necessarily say that they hurt, but you might notice that they're moving around in bed or they're wiggly a lot. Or you might also notice that they're not moving quite as much, because maybe movement makes the pain worse. Sweating. And also a change in vital signs. This is a time that you would look at blood pressure going up. This is a time that you would look at heart rate going up. You might look at respiratory rate going down, because they might be breathing more shallowly because they don't want to increase the pain. And so this is just really a helpful tool to help you get to some of the right questions. I think that I use this in every setting that I work in. Even when I'm on Sundays and I'm putting the patients in the room, I usually will ask these questions before the doctor even gets in. When we're talking about the severity of pain, so how much pain is there, it's really hard for people to put an exact, very concrete number on it. But we try and ask them, and we try to get it to an understandable point for us, because we can't feel other people's pain. So there are several scales. The one that I see the most commonly, and I actually don't have any research on this one, but most commonly you walk into the room and you ask, somebody tells you that they're in pain, and you ask them to rate their pain on a scale of 1 to 10. Usually I modify mine and say, so could you tell me what your scale is on 1 to 10? 1 being you're sitting on the beach, having a great time, and 10 being the worst pain that you've had. You're grabbing my ceiling, it's that much pain. Or childbirth for women is a common 10. And different people modify it different ways. I just feel like it's easier for me to give people examples of things that might be a 10 and might be a 1, so that they can use that scale. And usually he'll give you a number, and I've seen numbers anywhere, like, oh, I have a 3, this headache's been a 3 for a few days, or oh my God, it's a 10, but they're sitting there and their vital signs are fine. And so again, this is a very subjective rating, but at least it helps you understand a little bit more. But there are some people who can't quite understand scale of 1 to 10. Children and babies don't generally do well with that conceptual sort of idea. So there have been a few scales that have been developed to help us rate children's pain. And one scale that is very, very well rated, and there's been a lot of research, so nursing, we try to base our practice on research. We try to make sure that there's evidence to help us when we're using tools to evaluate things like pain. So this particular scale has been evaluated as both reliable and valid, and children prefer this. In one study of African American children and all of the groups, African American children, the white children, the children prefer this to several of the other scales that they tried using. They tried using just a number scale, and I think they tried using one other child assessment scale. And what this is basically a scale of faces, and it has the numbers so you can translate it. And every time I had a little kid come in, I had a little girl with a hurt ankle the other day. And so I said, this is a person, and I want you to think about where your pain is in your ankle and how much your pain hurts. Does it not hurt at all, and so you can be happy and smiling? Does it hurt a little bit so your smile isn't quite as big, and it just is a little. Does it hurt a little more than that? You just don't really feel like smiling. Does it hurt even more, so you're kind of sad? Does it hurt a whole lot, so you're very, very sad? Or does it hurt the worst, so you're almost crying? It hurts so much. Do you use this one?
Yeah.
And do you do the same sort of?
Yeah, we actually have on our ID cards a little miniature version of that. That way you have it on you at all times. So if you're assessing your pain, you show it to the patient. They're bigger because.
And what's the youngest kid that you'll use this on?
Kind of depends on developmental levels, but you'll start around when you're more able to talk. Usually, if our kids are intubated and they're breathing tube, it makes it a little harder for them to respond if they're for weeks.
Do they ever point when they're intubated?
If they're not restrained, yes.
Yeah.
But that makes it a little harder. But sometimes they will. Sometimes they're up to so weak after surgery that even the idea of is too much for them.
This has been shown to be useful for children ages 3 to 18, but like you said, it also depends on their developmental level. So a 3-year-old who's a little bit slower might not be able to use this. And the other thing about this is that it's more valid when you do use the word descriptor scale. So sometimes you'll see this just with the numbers and just with the faces. And so it's been shown to be more useful if you actually do talk to them and describe each of the faces and go through them. Another scale that we use to rate pain in babies, and this is babies, not in children, is the FLAX scale. And so I've seen this at Brigham Young Women's when I was doing my postpartum rotation. We used it when we were giving Hep B injections to the babies. And this looks mainly, these are just observational things that you can make. So if the baby is calm, doesn't have any particular expression, is smiling, you rate it as a 0. If its legs are normal and relaxed, if it's lying quietly, it's not crying, it's content, 0 pain. So a lot of times we've been using, they've been trying a lot of things for pain relief in babies. They've been using like a sucrose solution, which is just sugar water, which has been shown to relieve pain in babies. They also have, for younger kids, lidocaine that they'll put on before they give an injection, leave it on for a few minutes, and it numbs the area a little bit. And so you can tell whether or not it's working if they're all scoring a 0 and you're giving them an injection, which is a painful procedure. But then, each of these has a progression. So you can tell maybe it's a little bit of pain if they have a grimace or a frown, if they don't look interested, and it's a lot more if they're quivering, if they've got a clenched jaw. The same thing with the legs. The legs are kind of moving as opposed to being relaxed. Or if the baby brings their legs way up to their stomach and they're tense, and if they're kicking, that's a sign of more pain. And what you do is you take each of these and you add them up, and for a total score of 10. So we're looking at a score of 1 to 10 in most of these. The interesting thing about this one is that this has been rated really well when they did research. When they looked at different nurses, each of the nurses who observed the same baby, maybe on a videotape, rated the baby's pain the exact same way using this scale. And it also showed that the babies had response when they were given pain medicine, and so their scores went down, which is what you would expect if their pain is being relieved. So it was shown to be very valid. And this can be used for babies 2 months old to 7 years. I think I would use it more on neonates. Do you use